In today's video, I'm gonna give you a lot more information about the blood clots and give you also information about risk factors that you will develop blood clotting. That is one of the serious conditions of the modern world. You can develop blood clots in the heart, or the lung, legs, brain, and this is one of unbelievably serious conditions that can lead due to the sudden death. Type of blood clots. Blood clots can occur in your veins and arteries. Both are the vessels that help transport blood through the body, but they function differently. Veins are the vessels that carry oxygen-depleted blood from the body in the organs and back to the heart. When abnormal blood clots form in the vein, it may restrict the return of the blood to your heart, causing pain and the swelling, and the blood gathers behind the clot. And one of the most serious conditions that can develop about blood clotting is going to be something called deep vein thrombosis. Deep vein thrombosis is a blood clot that forms in the major or deep vein in the body. Most deep veins blood clots occur in the lower leg or thigh, but they can also occur in other parts of the body, like the arms or pelvis. When a blood clots in a deep vein breaks off and travels to the bloodstream, the loose clots is called embolus. An embolus can travel through the heart and the artery in the lungs. When it becomes wedged, and the blood blocks blood flow. This is extremely dangerous conditions called pulmonary embolism. Typical signs of pulmonary embolism include sudden breathing difficulties, coughing up blood, and the chest pain. That is a very serious conditions that you develop blood clots in the lower extremities, especially in your legs, and the blood clots forms and travel all the way to your lungs or maybe heart, and this is unbelievably serious situations. Clotting that occurs in the arteries is different than when it occurs in the veins. Arteries are muscular vessels that carry oxygen and nutrient-rich blood from the heart to other parts of the body. Clotting in the arteries is usually associated with the hardening of the arteries, called atherosclerosis. Atherosclerosis occurs when plaque narrows the inside of the vessels. Plaque is made of cholesterol, fatty substances, cellular waste products, calcium and fibrin, and clotting material in the blood. When the passage in the artery begins to narrow, the strong arterial muscle continues to force blood through the opening with a lot of pressure. This can cause the plaque to rupture. The molecules that release in the rupture can cause the body to react by forming an unnecessary clot in the artery. At this point, your tissues and organs no longer get enough blood, or they might not get any blood at all. Because this kind of blood clots usually develops in the coronary arteries or inside the heart, it can cause heart attack or stroke. In fact, atherosclerosis is the primary cause of the heart diseases and the stroke. In the Western societies, its underlying cause about unbelievably 50% of the deaths. Stroke and the heart attack are one of the most dangerous diseases of modern world. Millions and millions of people dying each day just because of this reason. So this means you have a blood clots in the artery and you put yourself in the high risk of the stroke and the heart attack. Venous blood clots risk factors. Blood can form in the deep veins of the leg if blood flows in restricted and slow down. This may happen when you are immobile for the long periods, such as after surgery, during the trip in an airplane or a car, or you must stay in the bed for extended time. Venous in the vein blood clots are more likely to develop in the veins that have been damaged from certain surgeries or trauma. Some other factors that increase your risk of developing venous blood clots include a family history of blood clots, age over 60 years old, obesity, pregnancy, smoking and oral contraceptives. Some medication or illness such as cancer or genetic coagulation disorder can also increase the risk of developing blood clots. One of the risk factors that you will get get blood clots something in your life, it's going to be unbelievably use of the synthetic medication each day. One of specific danger in medication is going to be hormonal therapy, especially if you take a large quantity of something called estrogen and progesterone. This is the hormonal influence in your body that you receive from your doctor, especially if you have some kind of problems with your menopause or any kind of hormone disorder, especially for women. Estrogen and progesterone oral contraception has been associated with the increased venous blood clots, heart attack and stroke. These oral contraceptives affecting blood clotting by increasing plasma fibrinogen, which help in the formation of the blood clots. Research also shows that cancer is one of the most important acquired risk factors of venous thromboembolism. This may be due to the tumor, the patient's body, or the therapies that patient receiving. This is actually the second leading cause of the death in hospitalized patients with the cancer with the infection. This is also unbelievably important information. For everyone that suffers from the cancer and you're receiving the treatment like chemotherapy, you are in high risk of developing, unfortunately, blood clots, and that is one of the main causes the deaths in the patients with the cancer and chemotherapy. Unfortunately, that is the situation. Arterial blood clots. Causes and the risk for arterial clots include obesity, lack of exercise, high blood pressure, high cholesterol, diabetes, and smoking. Lifestyle changes and the diet modification can help eliminate those risks. According to the research published in the Blood Transfusion, people with metabolic syndrome have at least 3 of the following health issues: abdominal obesity, elevation of triglycerides, reduced HDL cholesterol, elevated blood pressure, and elevated fasting glucose. This is increasing evidence that there is an association between arterial blood clots, atherothrombosis, and these contributors to the metabolic syndrome. In addition, the meta-analysis of randomized control studies have found that there are 3 health changes that can help you reduce your chances of developing arterial diseases. It includes blood pressure, cholesterol reduction, and smoking, of course, avoiding smoking. But unfortunately, we live in the world right now that a lot of people eat unhealthy diet, lack of exercise, obesity, taking a lot of medications, and we are here where we are here right now. We are in the period of the history that we have most diseases than ever before. We drink a lot more medication than ever before, and we get sicker and sicker and sicker and sicker each day. At the end of the show, I'm going to give you my recommendation how to reduce the risk of blood clotting. That means you need to take a health way of living. You can find also in my books, and I'm going to give you one easy solution. And that is something called Munogen, and Munogen is the one natural supplements in my food health store. Everything is linked down below. In the Munogen, you will find something called like this kind of pills, and in these pills you have every natural solution in high concentrated organic formulas for the preventing blood clots, heart attack, reduce heart pressure, and much more. If you want, you can check on link below. This is my suggestion, of course, for you. And also, my dear viewers, a lot of you watching me each day, but you unfortunately didn't yet subscribe to my channel. So if you want give yourself a chance to receive every day my new video, and also you want to support my dedication for you for the last 5 years, please down below click on subscribe button. Also, unbelievably important is click on the bell ring, and that means you will receive each day notification about my new videos. Everything, of course, is free for you, but this is the way for you supporting me, and everything, of course, is in the link below. For the end of the show, of course, my dear viewers, I'm going to give you information what is the best vitamin that can help you a lot reducing risk of the heart attack, blood clots. You can find in the video, of course, right here. God bless you, God bless your family, my dear viewers. See you in the next video. Bye bye.